beginning of the course, there was a lot of rote memorization, a lot of reading, and a lot of, what is a computer, just some basic foundational items. As we've gone along in the course, we've applied some of those specifically around disaster recovery, around business continuity, around population health now, and also into, rev cycle. So it's not just about, what is this, or an answer that's straight out of the book. Now we're looking at more of the application of some of the knowledge that you've gained in the first few weeks of this course. So we're not going to be looking at the book as much, although you can certainly use it as a resource, but we're looking at how are you applying that? What are your discussion points on the papers, position papers? Are you able to articulate your point of view and back it up of why you feel or you think a certain way? And then, of course, on the final paper, can you bring all of that information together from the first part of the course and be able to put together the final paper? As you go through your assigned readings and the resources that you'll find, some of the videos, etc., you're going to find that this course, this is not covered in our book at all. This is not something that is covered, but I feel is very important, especially when we're looking at populations of people and your role as healthcare administrators taking care of these populations, whether they be at a facility level or at an organizational level. So that's why we've included this portion in HCA 316, and we want to make sure that you do have a well-rounded education regarding this. So it kind of goes without saying that since there is not a PowerPoint with this module, nor is there a reading in a textbook for this module, when you're looking at the videos and you're reading through the articles that have been assigned to you, please take notes, because those will be the things that will be on the quizzes or will be in the discussion points in the module. Welcome to our discussion on population health, clinical quality, and patient outcomes. In your course of study, you're going to be taking a class 435 and also 440 that are going to look more in depth on clinical quality as well as with patient outcomes. However, I felt it was important to acknowledge and to look at patient outcomes, population health, and clinical quality through the perspective of healthcare IT, because of course that's where all the data comes from. In the first few weeks, we really talked about the electronic medical record, the healthcare IT, the infrastructure, as well as HIPAA, and we looked at what could possibly happen and how we protect that data with disaster recovery and with business continuity. However, what we haven't discussed really is how that data can be utilized. Now, outside of HIPAA, which of course is identifiable PHI, there is also non-identifiable information that's not covered under HIPAA. And that information primarily is demographic as well as disease state. So that non-identifiable information, such as if a patient presents to the ER with a stroke, or perhaps their demographics around their race or ethnicity, we could even look at their age and banding around their age groups to be able to come up with a determination, their gender, of course. We could certainly look at any comorbidities that may also be impactful in that. All that data being put into the electronic health record can be pulled out and looked at, stratified, and analyzed. And that's primarily what the purpose behind population health is. To give a more recent example, perhaps, would be, for example, the opioid epidemic. Is there something in that population that we can pull out that can help us provide a plan of care that we can then apply across an entire population? Now, the thought of taking data and looking at a population and analyzing it has been something that's been around for many, many years, but only since the early 2000s has it really been coined or given a term of population health. And as you can imagine, that's more or less along the lines of the advent of electronic health records and computers, data that can be extracted out of the system that clinicians put into the system. So since we now have that capability, now we have a population health, the ability to study health on a population level. Of course, prior to electronic health records and the ability to have data electronically available using just pencil and paper or pen and paper, it was much more difficult to try to pull that data together and then, of course, analyze that data. With the advent of the electronic health record and, of course, with interoperability standards and, of course, data analytics tools, this has made this job a lot easier for people that study population health, and hopefully will help them also come up with standards and with ways that we can improve the health of specific populations. And we can't mention the population health, the data that's being pulled out and analyzed, without also mentioning the impact on outcomes, which is ultimately what we as clinicians really want to do. Is we want to look at information, be able to make good determinations of plans of care, and then, of course, measure those. So do an assessment, put together a plan, implement the plan, and then evaluate the outcomes of that plan. For students taking this class that are nurses, they'll recognize that as the nursing process, API. So the study of population health has become so, I'm not going to say popular, but it's certainly taken off. As a matter of fact, the University of New Mexico, I believe, is the second university to offer an undergraduate degree in population health. So you have a whole course in your HCA curriculum that is dedicated towards that quality and outcomes and on population health and things of that nature. Well, there are entire undergraduate degrees that are available. In fact, I believe that the University of Alabama actually offers a graduate degree in population health.